Hello, this is Paul O'Connor, and I'm going to provide a bit of background to Medical Exam Tutor, which is a new virtual patient education platform. So I just want to let you know that I'm an investor in this product, and I'm also on the editorial board, and I'm a contributor to the content as well. So Medical Exam Tutor is an example of screen-based simulation. So there's two types really. There's serious games and there's virtual patients. So serious games are things like where you have an avatar and you move through the hospital or whatever, and you treat patients and you do things. Whereas what we have here with Medical Exam Tutor is more of a virtual patient setup, where we are simulating real-life clinical scenarios, a bit like standardized patients, but we're presenting it on the computer. So this slide is slightly facetious. We have the blade element diagram here, which is how lift is created from a wing. And certainly when you learn to fly, maybe they give you a bit of information on the aerodynamics of the aircraft, but that's not the focus of it. The focus is on actually the practical aspects of how you might recover from a stall, and in this case actually, if your plane does stall and you crash into the water, actually how you egress from the aircraft. Medical school, perhaps at least in this country, is a little less practical, where it's quite theory based. So the question is, how do we get these young doctors and other healthcare professionals to apply this theory in a practical setting? We know from the literature and also from our own experience that junior doctors often they're not well prepared to manage the acutely unwell patient, and that's despite the fact that oftentimes they are the first doctor that is called to manage that patient, and yet they don't really have the practical skills yet to allow them to do that. The other issue, certainly again in this country, is there's been changes to how medical education and patient care are delivered. So we have hyper-specialization. In Europe, they've limited the number of hours that junior doctors can work. I know in the US it's 80, but now in Europe it's 40. So how can you deliver? How can they learn how to deliver care to patients in a practical sense with the way that we've always done things? We've got to think of new ways so that to give them a chance to apply this book knowledge to realistic patient scenarios. So we as educators of junior doctors or interns looked around on the internet. We talked to the interns to look at the kind of websites, the kind of study materials they were using to prepare them for the practicalities of being a junior doctor. And there's quite a lot out there. However, we didn't feel it was quite delivering the training experience we were looking for. We wanted something that was quite polished, that gave a range of experiences, that allowed them to really interact and force them to make some clinical decisions about how they might care for a patient. So because we were unable to find a product that really met the demands that we had, we thought there was room to develop our own product, and that's how we came up with Medical Exam Tutor. So we present these clinical cases, and the user has to make decisions just as if they were a real doctor, from first contact to the patient, all the way through ordering tests, to diagnosing, through treating that patient, all on the computer. And the idea is to give them this realistic experience. And they get feedback on their performance. We get feedback on what they get right, what they get wrong, and they also get more general access to protocols for how to manage similar patients. And on the next slide, there's a short kind of promo video that we developed that will help you get a little bit more of an idea of what it is.
What if doctors could develop their clinical skills without risking a single patient's health? Practicing common medical scenarios from any online device. Selecting from a substantial bank of cases. And managing the virtual patient from presentation to treatment. What if doctors could learn interactively, making decisions at every stage of the patient journey, getting in-depth feedback on every decision they make, and easily reviewing their performance and learning from their mistakes? What if they could practice long and short cases all on one platform with video, images, lab and X-ray results, real clinical data, and lots of ways to help them focus and ensure the highest yield for their time? What if they could take control of their own learning, understanding exactly where improvement is required, which specialties need the most focus, and tracking their progress over time? What if delivering clinical training could be simple and efficient, with easy access to a bank of clinical content, so learners can absorb information at their own pace and improve both their clinical ability and their exam performance? Ready to bring clinical preparation to the next level? Request a trial at your institution today.
So Medical Exam Tutor is developed by a number of different medical educators, but it's led by Dr. Dar Byrne, who is a surgically trained by background. And not only do we have doctors and educators, we also have a marketing person and an accountant on the team, which is actually ludicrously important. We contract out the development of the software, and our funding comes from private investors as well as from Irish government grants, which we've applied for and been fortunate enough to win. So in terms of markets, we're marketing it to individual users, so generally medical students at the end of their medical school training. We're also trying to market it to medical schools as well, with the hope that they might buy a kind of site license. The content at the moment is 70 of these long cases that I talked about, but also 500 short cases, and we're adding new cases every month, so about 2 long cases a month and roughly 20 short cases a month. So we keep trying to add and grow the existing content, as well as improving on the content that is already there. So if you want more information on the product, you can visit our website, and it's also possible to get some free access to some of the material on the site, so you can have a go and you can use it and see what you think. And thank you very much.